Good afternoon, everyone. This is Miles Price of Life Clinic here in Hong Kong. I'm a practicing functional medicine practitioner with the Institute of Functional Medicine, Functional Medicine University, and I'm also a registered nutritional therapist with the British Association of Lifestyle Medicine and Nutritional Therapy. And today what I wanted to just expand upon was my first video was the approaches we can take in these unprecedented times of protecting ourselves against a COVID-19 infection and reducing the risk of a severe infection response of the virus. So what I'm going to go through is the list of lifestyle interventions you can do and also the supplement recommendations which will be hopefully protective. So first things first, we need to look at our lifestyle, and that means boosting your immunity. So there are various anti-inflammatory immune boosting approaches you can take, which include taking a low carbohydrate diet, taking various supplements, and keeping your bacterial levels in your gut at a very healthy level. The supplemental recommendations I will be going through in some detail in a little bit. And this will be helpful also. So first thing is to reduce your inflammation. Now, pre-existing inflammatory conditions like heart disease, diabetes, hypertension have a constant low-grade inflammatory burden on the body, which can predispose a patient to an altered immune response when the COVID-19 virus infects. So getting to the root cause of that inflammation will reduce the body burden and maintain your immunity response. So this includes eating a clean, no processed foods diet, keeping it whole foods, cutting out gluten, maybe potentially dairy, and fixing the underlying causes of the inflammatory response itself. So that may be coming from an imbalanced gut flora, a leaky gut. That may be coming from getting rid of potential viruses or bacteria which are living in the body and creating an inflammatory burden. That may be improving the antioxidant status in the body, either by the foods or the supplements which can be taken. So a number of measures can be assisted here. The second thing to really focus on is the sleep. So maintaining at least 7 hours sleep or uninterrupted sleep a night is very helpful. Sleep is essential for the repair and the recovery of the body. And we need to be in bed by basically 11 p.m. If we go much later than that, then the physiological and psychological repair of the body is compromised. So studies have shown that people who do not get enough sleep are more likely to be sick after being exposed to a virus. During sleep, what happens is your body produces compounds called cytokines, which are part of the immune response. And these are produced when there's an infection or inflammation. So it's your body's ability to fight is a lot more effective at night when you're asleep. And sleep deprivation actually decreases the amount of these cytokines being produced. And in addition, infection-fighting antibodies are also reduced during periods of sleep. Now, if you're struggling with your sleep, with maintaining uninterrupted sleep or falling asleep, there are various other strategies we can advise to do to maintain that. And I'd really advise you to get in touch with us, and we can help you fix your sleep and making sure you sleep like a baby for the whole night. The next thing to do is think about regular exercise. So the right type of exercise, not too strenuous, will help boost immunity. Studies have shown that moderate exercise consistently taken reduces your illness risk. So as little as 20 minutes a day, studies have shown, that's by walking briskly, for example, will reduce the inflammatory messengers your body produces and improve the white blood cell activity, which boosts your immunity. The slight temperature rise in the body actually helps the body to fight infections better. However, If the exercise is too long or too strenuous, this can raise your stress hormones. So as your stress hormones rise, like cortisol, this has a depressive effect on your immune cell activity. So the goal is consistent, continuous exercise, but not too intense. That's the goal. The next thing to look at is making sure you have an anti-inflammatory diet. Now this is typically following a low carb or ketogenic, high antioxidant diet, and having high carbohydrate meals too often, what happens? This depresses your immune system response in the body. So studies have shown that high blood sugar or hyperglycemia actually damages your innate immunity. This innate immunity is your body's first line of defense against a viral infection. And this is your ability of your body's white blood cells to attack the viruses the first time they see them. And this involves mechanisms like killing the viruses and swallowing them up. So high blood sugar can deactivate your immune system for a couple of hours until the blood sugar level starts to come back down. But if you're diabetic and you're insulin resistant, this can take a lot longer. So it means you are more vulnerable to the virus potentially taking hold if your blood sugar is elevated for a period of time. So by going on a low carb, ketogenic diet, you're lowering your blood sugar, you're lowering your insulin levels, and you'll be able to maintain that immune response, which is critical for the exposure to the virus time. So what does this mean in practice? What this means essentially is going low carb, cutting out rice, breads, pastas, pastries, cakes, high sugar fruits like pineapple, mangoes, melons, bananas, and desserts. And foods which will boost your immunity to consider taking are citrus fruits, berry fruits which are high in vitamin C, making sure you have the garlic for the allicin, broccoli, spinach for the vitamins A and C, yogurt and kimchi foods which are fermented type foods for the bacterial levels which actually have shown to boost immunity in the gut and systemically in the body. And also taking vitamin E rich foods which alongside vitamin C help to boost your immunity. So this includes foods like almonds, avocados and sunflower seeds. So if you want more information on the ketogenic diet approach or the low carb approach, please get in touch with us at lifeclinic.com.hk, or you can get in touch with us by phone. That's 2881-8131. Now, let's go straight into some of the supplement regimes which can be very helpful to support your immunity. So, these are for adults, and the first thing to take is potentially elderberry. Elderberry at a dose between 700 and 1,000 milligrams on a daily basis, either in capsules or lozenges. Elderberry has been shown to be very effective with another type of coronavirus called NL63, and this is shown to directly stop the attachment of the virus to the ACE2 enzyme, which is the backdoor pathway the virus uses to get into the cell. It has also been shown to destroy the lipid envelope around the cell, the virus directly. So it has a two-pronged approach here. In terms of safety, I wouldn't go above 1,000 milligrams a day, but I think it's safe to take for up to 3 months for getting the protection. The next thing to consider is taking nutritional zinc between 7 and 15 milligrams daily, or taking twice a day. And the best forms of zinc would be glycinate, gluconate, acetate, for example, but do not take zinc oxide or zinc picolinate. If you're taking zinc, do not take it with foods like legumes, grains, nuts or seeds, because they will block the potential full absorption of the zinc. Also consider taking zinc lozenges like zinc acetate. Suck on it for 1 a day, or if you know you're getting an infection, you can take multiple lozenges every couple of hours to maintain that immune response. Zinc has been proven actually in the SARS infection, which had happened in Hong Kong back in 2003, to target 3 different areas of the virus biology. And therefore, because of the effect on SARS, we assumed that the effect would be on this type of virus, the COVID-19. Zinc interferes with the virus replication process directly, and helping zinc access the mucous membranes of the throat can provide a good general defense against the virus. The next thing to consider is having your copper in your diet. So aim to ingest between 2 to 4 milligrams of copper a day. And this can be in the form of a supplement, copper glycinate, or you can take it from copper-rich foods. The balance between copper and zinc is actually quite important. So you need to aim for a ratio of 15 to 1. That's 15 milligrams of zinc to 1 milligram of copper. The contraindications for copper are that it is not really advisable for cancer patients to take or people with Wilson's disease. Copper is toxic to coronavirus, and this is particularly demonstrated in studies when they put the virus on surfaces which are high in copper, like brass, and what they found is the viruses have been deactivated within a couple of minutes, compared to other surfaces where the virus stays around for a lot longer. And it has been shown that copper really is disruptive to the virus biology. The next supplement to consider is garlic. Either taking as a crushed food where you've left it in the air to develop the allicin compound, or to take the allicin extract at 180 micrograms a day, which is shown to be very effective. It has strong antimicrobial effects, and it has shown particularly effective against other types of viruses like the common cold, where it reduces the symptoms by potentially 60%. It is shown to attack the lipid envelope of potential viruses like the coronavirus, and it shares the similar properties to zinc, so it can actually accentuate the effects of zinc more effectively. Additional supplements to think about as the baseline dosage would be vitamin C. So if this is not coming from your foods, maybe a supplement of up to 300 milligrams of vitamin C daily. You can source this from various foods like yellow peppers, green peppers, currants, broccoli, kiwi fruits, 3 to 5 servings of oranges and strawberries, or plant-based vitamin C, which you can get either from our clinic or from online. There aren't any particular studies showing the effects of vitamin C on the coronavirus. However, a baseline support will be making sure your immune system stays vigilant. Baseline dosages of vitamin A as found in cod liver oil or eggs would be advised, so getting up to levels of at least 3,000 international units a day would be protective, and this would be 1 up to 4 capsules of cod liver oil, or 2 eggs per day. Vitamin D is generally not recommended for protection against the coronavirus at high dosages because it actually activates the AC2 pathway, which allows the coronavirus to get into cells. However, maintaining a baseline level of vitamin D is going to be helpful. So if you're taking around 1,000 international units a day, this would be a good baseline level. It is also advisable to consider getting yourself tested for your vitamin D levels, and if you are getting yourself tested, make sure your results are showing at least 30 milligrams per deciliter as a baseline level. If you're achieving that level, then you are sufficiently achieving good levels of vitamin D in your blood. Now, this is not representing medical advice. This is just the lifestyle interventions we'd like to share with you from Life Clinic. And if you have any further queries, please do get in touch and we will be happy to assist. Stay safe, guys, and all the best.